Good evening. Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and we're going to have a short video here tonight about DKA, HHS. How do you treat it? There's a video on the development of DKA in type 1 diabetics, and there's a video on the development of HHS, hyperosmolar hyperglycemic state in type 2 diabetics. So check out those videos for more details about how this happens. This video is more how you treat it. Now, the title of this YouTube channel is Bread and Butter Primary Care. I want to stay true to that as much as I can. So I will mention straight up that these are conditions that are treated in an inpatient setting. So there's not much you can do without IV access in order to treat these severe emergent diabetic conditions. And so really from a bread and butter primary care standpoint, what do I do in these situations? The answer is you call 911. You get help there, and you get the person to the hospital or wherever they can get an IV as soon as you can. So if you're in a situation where for some reason a patient is coming into your outpatient office, maybe an urgent care or something, you're covering at a night shift or something, and they're confused and throwing up and they don't even know where they're at, and their coma score is starting to go up, and you do a finger stick glucose and it's 600, that's an emergency. That's a call 911, get the ambulance there, get them somewhere where they can get an IV. The treatment for these conditions, in short, is fluids and insulin. I remember in residency being at a grounds, and we were discussing these conditions, and the lecturer or preceptor or whatever who was teaching it really pounded that point home as far as what's the treatment for DKA, and it was fluids and insulin, fluids and insulin, fluids and insulin. Remember, in DKA, the problem is that type 1 diabetics, they do not make insulin, and so the answer is to give them insulin. Insulin works in type 1 diabetics. It works just fine. They just need it. Fluid is for blood pressure control. So you want to get these people to the hospital. They need IV access, and then they need fluids for blood pressure to maintain blood pressure and circulation, and they need insulin to bring down the sugars. Now, there are more complicated things that come into play as far as potassium levels and other electrolyte levels and things like that. I'm not going to claim to be an expert in the treatment of those situations. It's definitely outside the realm of bread and butter primary care for outpatient medicine. So mainly, just remember, get these people to the hospital, and then they're going to do fluids and insulin. Now, in HHS, remember, it kind of depends. In type 2 diabetics, it depends on each patient. So it may very well be the case that there's plenty of insulin, and really it's just a matter of blood pressure support, electrolyte control, and then finding a way to help get the insulin to work. And sometimes the only way to do that is to flood the system with more insulin, because it's not an all or nothing game. So a type 2 diabetic is not that 0% of the insulin works. It's that maybe only half of it works, or some percent of the insulin is functional. And so sometimes even though they have insulin and it doesn't work, if you flood the system with just an overabundance, the percent that does work can help bring it down. And so if you have a person coming in and they seem sick, because they come into the office or they're in the urgent care or something, and like, man, this person doesn't look good. You can tell they're sweaty, they're confused. You're thinking kind of emergent type things. Is this a heart attack? Is this a stroke? Is this an injury? Is there a bleed? Have these things in that differential. Could it be a hyperglycemic problem? Could it be DKA? Could it be HHS? One of the good things is almost all offices can check a finger stick blood sugar at any time. So while you're getting things, while you're calling the squad to come get this patient, grab an grab a finger check, check that sugar. That way, if it's super high, you have that information to give to the the squad once they arrive. They'll know kind of more what to do and immediately what to do with this patient. And so not a lot on the treatment of these conditions, like I said, because it really is an emergent inpatient type of treatment. But just remember, if you're concerned about a patient's stability, get a finger stick sugar if it's super high. squad hopefully is already on the way. Let them know so they can get an IV started to get the person fluids, insulin, and hopefully save their life. So I hope that's helpful. I've had a good time talking about these diabetic emergencies tonight, and hope you guys have a great night.